Chromium's not a well accepted biomarker because you can potentially see in deficiency impaired glucose tolerance, but plasma's not a good indicator because the levels are too close to detection level and urinary excretion is controversial. This is looking at trivalent versus hexavalent chromium and talking about chromium picolinate toxicity, showing that chromium supplements can cause renal impairment when ingested in excess, but they are challenging to be able to identify. Trivalent chromium is an essential trace element. In normal quantities, it's safe, but in excessive amounts can be dangerous. It can help regulate glucose metabolism, which is why a lot of patients supplement with it. And it's exists as a component of the glucose tolerance factor, which increases the effect of insulin by helping it bind to its cell receptor site. Chromium can regulate plasma lipoprotein concentrations and reduces serum cholesterol and triglycerides itself. And this is just showing its involvement in insulin regulation. Manganese is not really a clinical or public health concern. The plasma levels will reflect dietary levels, down with restriction, up with supplements. A high concentration of manganese is in our mitochondria, and it functions as a necessary factor for activation of our glycosyl transferases, which help us synthesize glycoproteins, for instance. It also is required for superoxide dismutase activity to activate our metalloenzymes. And if there's a deficiency of manganese, it can extensively reduce glycoprotein and proteoglycan formation. Molybdenum is required for the function of our metalloenzymes, and some of these are listed here. The biomarkers for deficiency, you could look at a decrease in urinary sulfate or uric acid, elevated urinary sulfate, hypoxanthine and xanthine, as we can see that they xanthine oxidase, this conversion here, uses a molybdenum needed cofactored enzyme to do this conversion. Lastly, on our kind of slide set is looking at what is micronutrient testing. And so this is just an example of a place that does micronutrient testing. There's lots of different places and labs that you can order this through. It's not your average test as it's a functional test for nutritional status, and it's not measuring actual levels of micronutrients. It's measuring how your cells are using micronutrients. It can give up to a 6-month history of nutritional status of a person and the average lifespan of lymphocytes that generally show change of, and the generally slow change of the intracellular nutristatins create this like 6-month window. So how do we do this? Blood is centrifuged, it's washed less than 48 hours after the draw. Lymphocytes are isolated out of the blood, and then an identical number of lymphocytes are incubated in 99 individual wells with various specific growth media for 5 days. Some are grown in complete media, some are in the media deficient in a particular nutrient, and some in media supplemented with particular nutrients. A growth mitogen is added to stimulate growth for the last 4 days. And so on day 4, a radioactive label is added, and absorption of this label determines the amount of growth or cell division that occurs on that last day. And so essentially, they isolate the lymphocytes because this is a longer term nutritional marker. They then incubate and grow into culture media. This is patented. So each kind of testing facility has their own patent or their own way they do this. Then they give a mitogen stimulation to essentially create more growth. And this is varies the components. The growth amount will vary depending on what the intracellular levels are of stuff of these nutrients. They will then tag with thymidine incorporation, and this can measure 200 different growth measurements. And then they will actually measure and evaluate the growth response measurement to see if there's deficiencies, transport, and metabolic requirements. So once they kind of have done this process, cell growth in the complete growth media is given a value of 100%. This is considered optimal cell growth for that person, and all other test media are compared to this value. Cells without a nutrient deficiency are expected to grow in a specific nutrient deficient media as well as cells growing in complete media. This is because they have sufficient stores of a nutrient to continue to normally grow and divide. Cells that have specific essential nutrient deficiencies when put in a growth media that is also deficient in that same nutrient should exhibit decreased growth or division, in theory, because this occurs because the intracellular stores of that nutrient become depleted within the 5-day test period. So these are all the different nutrients they analyze, including some of the ones that are more challenging for us to do blood tests on, right? Copper, selenium, zinc, and chromium. And this is what they might look like given a percentage. And so, should you do micronutrient testing? You can, absolutely. It can be helpful, but you need to evaluate it based off of context and make sure that you're informing your patient that this isn't what their actual values are. This is just making an inference based off of how cells are doing in an outside of the body environment placed in growth media that contains or doesn't contain certain nutrient components. But some patients and some people will, this might be a way to get an idea of their multi-nutrient status. That was our quick run through on some nutrients this week to go along to accompany with your comprehensive metabolic panel. So we had all of our minerals within 1 week. We will continue to dive into our different analyses as we move forward.